Overview of autism characteristics. The National Institutes of Mental Health has identified several characteristics commonly associated with autism, emphasizing that the presence of any single trait does not necessarily indicate autism. Autism is a complex developmental disorder, and a diagnosis generally requires multiple traits. Children may reach developmental milestones on time or even early and still be diagnosed with an autism spectrum disorder, ASD. Some children display typical development initially and then show autism traits, while others exhibit these traits from infancy. Common early signs of autism include no babbling or pointing by age 1. No single words by 16 months or two-word phrases by age 2. No response to their name. Loss of language or social skills. Poor eye contact. Excessive lining up of toys or objects. No smiling or social responsiveness. Over or under responsiveness to sensory stimuli, e.g., touch, smell, taste, noise. Autism traits usually manifest before age 3, but some children with milder traits might be diagnosed later. Later diagnosis often involves indicators such as difficulty making friends, lack of imaginative and social play, repetitive or unusual language use, intense or unusual interests, preoccupation with certain objects or subjects, inflexible adherence to routines or rituals. If traits appear suddenly in a child older than 3 and were not present earlier, the child would typically receive a different developmental or psychiatric diagnosis. Less common traits in autistic individuals may also experience seizures, intellectual disability, Savant syndrome, exceptional abilities in a specific area, hyperlexia, early reading ability without comprehension, synesthesia, associating words or ideas with sensory experiences, low muscle tone and/or motor skill challenges. Subgroups and complications in autism. Autism encompasses various subgroups, often associated with other conditions. Gender differences in autism presentation. Autism is more commonly diagnosed in individuals assigned male at birth. Autism presentation can differ by gender. Autistic males often display overt behaviors like stimming, loudness, and emotional reactions. Autistic females may appear quiet, withdrawn, and less engaged in group activities, sometimes mistaken for shyness or social reticence. However, individual variations exist. Association with other conditions. Autism often co-occurs with other developmental and mental health disorders. Additionally, autistic individuals may be prone to issues not included in diagnostic criteria, such as sleep and gastrointestinal disorders, self-abusive behavior, etc. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, specifies coexisting conditions like intellectual impairment, ADHD, language impairment, and various behavioral and mood disorders. When to seek medical advice discerning autism traits from typical developmental variations can be challenging. Some developmental differences might stem from other issues, like hearing impairment or speech disorders. Professionals use specific tests to diagnose autism. Concerns about a child's development should be discussed with a pediatrician, and if necessary, a developmental pediatrician or specialist. Frequently asked questions. 1. Age of autism trait development. Autism traits typically develop before age 3, but diagnoses can occur later, especially in cases with low support needs or in females. 2. Autism traits in infants, 9-12 months, delayed babbling or pointing, language development issues, and under-responsiveness to social stimuli are common indicators. 3. Traits of low support needs. Autism. This may include high academic performance with social challenges, sensory sensitivity, anxiety or depression, organizational difficulties, emotional regulation issues, and verbal communication struggles. So, let's chat about autism. Okay. First off, there's no cure for autism, and really, that's not what treatment is about. Autism is just a different way the brain works, and it's not about trying to fix someone. It's about helping them handle the challenges that come with it, like communication or behavior issues. There are therapies and meds that can help, but it's important to know that some can actually do more harm than good. Let's break down the treatment options and what to think about when talking to doctors about them. When it comes to picking treatments, it's usually a bit of trial and error to find what works best. You've got to consider things like what's available, what you can afford, and what suits the person with autism. Good therapies usually start early and happen often. They're based on solid research and have clear goals. It's super important to have a therapist who really connects with the person they're helping. And the therapy should be enjoyable, not a chore. There are a bunch of therapies out there, and some are covered by schools or insurance, which can be a big help because this stuff can get pricey. Now, about medications. Some people with autism might take meds to help with anxiety, focus, or aggression. They can be really helpful, but it's important to keep an eye on how they're affecting the person. Speech therapy is a big one. It can help with talking, understanding jokes and body language, and all that communication stuff. Occupational therapy is also common, helping with sensory issues, play skills, and interaction. Physical therapy might not seem obvious for autism, but it can be super helpful, especially for those with low muscle tone or coordination issues. Behavioral therapy, like ABA, is often seen as the go-to. It focuses on teaching skills and behaviors that help in school or work settings. But, it's a bit controversial because some people think it tries to fix autism traits instead of accepting them. Cognitive psychology can help sort out feelings and suggest ways to handle frustrations. It's especially useful for those with milder autism. If the therapies from school or insurance aren't cutting it, you might want to look into paying for other types, like developmental therapies that focus on emotional skills and relationships. There's also social skills therapy, arts therapies, and even animal therapy, which can be really fun and beneficial. But watch out for those so-called cures or treatments that sound too good to be true. Things like chelation, MMS enemas, detox baths, and other unproven methods can be dangerous and a waste of time and money. When you're looking into treatments, always do your homework to make sure they're legit and backed by good research. And if you're not sure, ask a healthcare provider you trust. It's easy to get swayed by other people's stories, but what works for one person might not work for another.